So in the last class we have discussed about the biosafety and then what is the biohazards, two categories in the biohazards, and then first one is the pathogen, and in the pathogen, what is the pathogen entry, what are the different routes of entry, and then what is meant by aerosol, and how the aerosol are spreaded, what are the by doing techniques, which techniques the aerosol spread from one person to the another or the researcher involved in the project, and then what is the pathogen risk, what are the risks from the pathogens, what are the factors which depends on this, and then what are the four risk groups available we have discussed, group 1 and group 2, group 3 and group 4, and then we have discussed about the containment as described as biological and the physical. So biological, it is a combination of vector or host, whereas physical, it is obtained by three categories: primary containment and secondary containment. So in the primary, laboratory practices and the containment equipment, whereas in the secondary, it is the special laboratory design. It can be achieved by the special laboratory design. In the secondary containments, there are three categories: basic laboratory, containment laboratory, maximum containment laboratory. Basic laboratory comes under the risk group 1 and 2. Containment laboratory, it is for risk group 3. And third, maximum containment laboratory is under risk group 4. So in this class, we are going to discuss about the biosafety levels. It consists of a combination of laboratory practices, equipment and facilities suitable to the procedures being performed and hazards of the pathogen. So in the biosafety level, there are different categories. So it is a combination of laboratory practice and also the equipment and the facilities suitable for the procedure being performed. Okay, என்னென்ன facilities எல்லாம் இருக்கு. Okay, so laboratory practice follow பண்ணனும். Equipments it should be safety level. Equipment it should be under the safety level. Facilities, what are the other facilities are available in the particular environment must be also favored for performing the experiment. So the four biosafety levels corresponds to four risk groups. So biosafety level they are categorized into four things. A lower risk group can be assigned a higher biosafety level if a biological risk assessment carried out requires so. So what is biosafety level 1? It is suitable for teaching laboratories and for facilities in which work is done with defined and characterized strains of agents not known to cause any disease. So in that condition, we have to follow good microbiological techniques. So this is the biosafety level in which we are doing now. Among the biosafety level 1, it is suitable for teaching laboratories and also for facilities in the work is done. So what is biosafety level 2? It is applicable to facilities in which work is done with the indigenous moderate risk agents present in the community and associated with human disease of varying severity. So various human disease kuria ஏதாவது ஒரு particular agent or particular virus எடுத்து நம்ம work பண்றதுல it comes under biosafety level 2. So BSL biosafety level 2 is appropriate when work is done with any human derived blood fluids, tissues or primary human cell lines in which presence of an infectious agent may be unknown. So இந்த இதல தான் நாம என்ன பண்ணுவோம், any particular ஒரு human being ஓட ஏதாவது ஒரு derived blood இல்ல blood fluids இல்ல some other tissues or human cell lines in which will be working. So அதுல இருந்து என்ன ஆகும், infectious agents spread ஆக ஆரம்பிக்கும், which may be unknown, நமக்கே அது தெரிஞ்சிருக்காது. So what are the conditions needed in biosafety level 2? We should follow good manufacturing, good microbiological techniques, use of personal protective equipments and the safety precautions we have to consider. Use of BSC, biosafety containers must be there. Use of autoclaves. So autoclaves it should be sterile. So அது good condition la irukanum. What is biosafety level 3? It is applicable to facilities in which work is done with indigenous or exotic agents where the potential for infection by aerosols is real and the disease may have serious or lethal consequences. கொஞ்சம் இன்னும் அட்வான்ஸ்டா பண்ற டெக்னிக்ஸ்லாம் பயோசேஃப்டி லெவல் 3ல வரும். ஸோ முன்னாடி சொன்னது பாடி ஃப்ளூயிட்ஸ் ஆர் தி டிஷ்யூஸ் ஆர் சம் அதர் செல் லைன்ஸ். இந்த பயோசேஃப்டி லெவல் 3ல it should have the facilities to work with the டாக்ஸிக் ஏஜென்ட்ஸோ இல்லை ஒரு இண்டிஜினஸ் சப்ஸ்டன்ஸையோ எடுத்து நம்ம ஒர்க் பண்ணும்போது அது மூலயமா the infection may spread. So it will have the disease may have serious or lethal consequences. So அது மூலயமா severe disease ஆகும் it may be spreaded to the researcher or the person involved in the particular laboratory. So BSL 3 requires in addition to BSL 2 requirements. Special clothing இருக்கணும், directional air flow இருக்கணும், controlled access must be there, double door entry must be there, supervision must be strictly followed. So these things are essential in the biosafety level 3 because you are going to work with the indigenous agents or the toxic agents. So these things beyond BSL 2 we need to follow. So those who are involved in the projects must have special clothing while doing the experiments. Directional air flow must be adequate. Controlled access இருக்கணும், அந்த environment must be under controlled access. Double door entry must be there. So நம்ம வந்து இப்போ பயோசேஃப்டி கேபினெட்டே இருக்குன்னா it should be in another door. ஓகேவா, நார்மலா ரூம் திறந்ததுமே இருக்கிற மாதிரி இருக்கக்கூடாது. It should be beyond the another door. இன்னொரு டோர் ஓபன் பண்ணிட்டு அதுக்குள்ள தான் அந்த பயோசேஃப்டி கேபினெட்டே இருக்கணும். அத மாதிரி தான் we have to design in case of BSL 3. So BSL 4 biosafety level 4 applicable to work with dangerous and exotic agents which pose a high individual risk of life threatening disease. So இதுக்கு ஒரு எக்ஸாம்பிள், இப்போ கோவிட்ல ஒர்க் பண்றாங்க, இதெல்லாம் வந்து they have to follow severe precautions. அவங்க வந்து எடுத்துக்கிட்டு தான் they have to work it in the BSL 4. So அதுதான் சொல்றாங்க to work with dangerous and exotic agents which poses a high individual risk of life threatening disease. So இது வந்து கோவிட் வந்து அது மாதிரியான ஒரு டிசீஸ் தானே. So they have to follow strictly guidelines. So BSL 4 requires in addition to BSL 3 requirements. What are the things needed? Positive pressure personal chutes. Strictly limited access must be there in the particular environment. Double-ended autoclave must be there. Class 3 biosafety cabinet and biosafety cabinet வந்து different classes are there. அதுல ஒரு high end version must be there. It must be provided. Airlock with shower and supervision must be there in the BSL 4. So these are the things in addition to the BSL 3 required in the biosafety level 4 category. So what is good microbiological techniques? GMT. Specimen containers must be correctly labeled for easy identification. எந்த ஒரு ஸ்பெசிமன் நீ எடுக்கிறனாலும் it should be what correctly labeled. ஏன்னா நீங்க அதை வந்து ஃப்ரீசர்ல வச்சுட்டு போகலாம், or else you will be storing in some other things. So it must be always labeled. நீ லேபிள் பண்ணி டேட் போட்டு வச்சுட்டு போகணும். In future some other is taking also they should easily understood. So it is not our work, it belongs to some other like that. We should use secondary containers while transporting specimens to contain spill. So நம்ம வந்து இன்னொரு autoclavable ஒரு இதை வச்சு தான் we have to transfer the specimens. So specimen containers received from external agencies must be opened in the biosafety cabinet. So அதே மாதிரி ஸ்பெசிமன் வரும்போதும் அதை வந்து நம்ம என்ன பண்ணும், we have to open it in the biosafety cabinet only. We should not open as such. Use mechanical pipettes use பண்ணி தான் we have to take the specimens. Open flame must not be used in biosafety cabinet as it can distort the airflow pattern and damage the filters. So open flame அது மாதிரி யூஸ் பண்ணக்கூடாதுன்னு சொல்றாங்க in the biosafety cabinet. Always use disposable gloves. Do not touch mouth, eyes and face with the contaminated hands. So அது மாதிரி யூஸ் பண்ணும்போது we should not touch our mouth, eyes and the face with the contaminated hands. We have to use gloves. Food and drink must not be stored or consumed in the laboratory. இது யூசுவலா சொல்றது தான். Glasswares must be replaced with the plasticware wherever possible. So எல்லா இடத்துலயுமே glass handling இல்லாம wherever it is possible we can use the plasticwares also. Sharps, that is the needle, sticks, glass must be avoided wherever possible as it can transmit bloodborne pathogens in case of injury. So அதெல்லாம் எங்கெங்கெல்லாம் வந்து அவாய்ட் பண்ண முடியுமோ அந்த இடத்துல we can avoid the glass materials. Use engineered sharp safety devices when syringes and needles are necessary. Needles must not be recapped to prevent needle stick injury. Puncture-proof containers fitted with covers must be used for disposing sharps. Okay, so these are the general good microbiological techniques. And tubes and specimen containers must always be securely capped for centrifugation. Centrifuge பண்ணும்போது நம்ம centrifuge tubes வந்து full-ஆ we have to screw cap it. அது வந்து கரெக்டாக பண்ணியிருக்கணும். Refer to manufacturer's instruction before operating the equipment. Centrifugeலாம் நம்ம ஆப்ரேட் பண்ணுறோம்னா we should follow the manufacturer guidelines. Work area must be decontaminated with a suitable disinfectant at the end of the work. Or weekly once or in a monthly once, if we are using any pathogen or any viruses, we have to decontaminate as soon as possible. Hands must be thoroughly washed before leaving the lab. Then personal protective equipment. So this acts as a barrier to minimize the risk of exposure to aerosols, splashes and other injuries. So it must be selected on the basis of risk involved in the task performed. நம்ம என்ன மாதிரியான எக்ஸ்பெரிமெண்ட்ஸ் பண்ண போறோமோ அதை பேஸ் பண்ணி தான் we have to select the personal protective equipment. Lab coat, safety glasses and toe covered footwear is a minimum requirement while working in the lab. ஸோ அதனால தான் நம்ம வந்து எப்பவுமே லேப் கோட் இஸ் மேண்டட்ரின்னு சொல்கிறோம். Beyond that, if you are going for further study, further cell lines or some that, we have to have safety glasses and toe covered footwear for while working in the laboratory. Face shield must be used if there is any risk of splashing of infectious material. ஒரு infectious material வந்து நம்ம எடுத்து பண்ண போறோம் அப்படின்னா we should use the face shield. கவர் பண்ணிக்கணும். Gloves must be worn for all procedures that may involve direct contact with blood, infectious materials or infected animals. Okay ba, so adha mari nama blood idella podumbodhu we should use the gloves. Blood illa or infectious material illa or animal death adha mari edukrom appadina you have to use the gloves. Gloves must be removed aseptically and autoclaved with other laboratory wastes before disposal. Gloves ya apdiye nama dispose panna koodadhu. We have to autoclave it and then only we have to dispose it. If reusable gloves are used, on removal they must be cleaned and disinfected before reuse. அது யூஸ் பண்ணனால என்ன பண்ணணும், we should use disinfectant. அது யூஸ் பண்ணி and then only we have to use it for second time. Lab coats and other personal protective equipment use must not be used outside the laboratory. நம்ம லேப் கோட்டோட என்ன பண்ணுவோம், பிரேக் எடுத்துக்கிறோம், இங்கே இருந்து அப்படியே போயிட்டு ஊரெல்லாம் சுற்றிட்டு அக்கௌண்ட்ஸ்லேருந்து இங்கேருந்து இன்ஜினியரிங் வரைக்கும் போயிட்டு திரும்பவும் அதே லேப் கோட்டோட தான் வருவோம். So we should not use lab coats and other personal protective equipment outside the laboratory.